The x-rays, you know, these are two-dimensional x-rays, the small x-rays that we take, so it doesn't really show much because sometimes there are things that are overlap. So you want to go clinically and check. And when they do that, so the norm really is between 1 to 3 millimeters. And what is that? What are these numbers? So you know your tooth. And guys, if you are listening to me and I'm actually talking and there is a video about that, so you can watch it on YouTube, the Wonder Tooth podcast on YouTube as well. So basically the measurements are, this is the tooth and this is the bone level, and then there is the gum on top of it. So you put that little probe and it should read the measurement from the top of the gum to the top of the bone. And the measurement in normal, like people, you know, who have no infection, it should read from 1 to 3 millimeters. If it starts to get deeper, this is when we get a pocket, which is basically like a separation in the periodontal ligament. And the periodontal ligament, it's a very tiny ligament that's holding the root of the tooth to the bone. And if you start to get a little separation there, sometimes it could be because the gum is just very inflamed, you know, pregnant ladies, hormonal changes. It can, we call it a pseudo pocket, but if it's getting deeper and like 5-6 millimeters, this is full-blown gum infection. And sometimes if you don't take care of it on like, you know, like quickly or quick enough, basically it starts to get deeper and deeper until it reaches basically the root, the bottom part of the root, or like beyond the root. And this is when it's beyond repair. Sometimes if there is a lot of bone loss around it, the tooth starts to become loose because the bone now that's holding it is like, I'm done. What you guys doing? Just get rid of me at this point. Some patients, they don't want to get rid of those teeth, even though there is so much mobility.